Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Dwight Ball and Dr. Janice Fitzgerald, Chief Medical Officer of Health. The Honorable John Hagee, Minister of Health and Community Services, is joining us via Skype from Gander. Please stand by. Our news conference will begin shortly.
Well, good afternoon again, everyone, and welcome back to this Wednesday media availability. I will now turn it over to Dr. Janice Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have no new positive cases in the province, and our total number remains at 261. In total, we have tested 16,620 people. Today marks our 27th consecutive day with no new confirmed cases of COVID-19 in our province. Because we have done so well in Alert Level 3, I am pleased to confirm that tomorrow we are moving to Alert Level 2. As I've said many times before, the progress we have made to date has been possible because of your support and commitment to following the public health measures in place. And I'm deeply grateful for your efforts and the trust you have placed in the public health system. The kindness and understanding I have seen firsthand during this most trying time has been truly inspirational and will be just as important moving forward as we continue to live with COVID-19 for the foreseeable future. As we transition to Level 2, we must remain vigilant for our own safety and for the safety of others. This means staying at home when feeling unwell, covering coughs and sneezes, practicing proper hand hygiene, and maintaining a safe physical distance from others of at least 2 arms lengths while in the workplace and public spaces. When maintaining a safe physical space is not possible, it is highly recommended you wear a non-medical mask to protect others around you, particularly vulnerable members of our communities. These simple prevention measures have played a critical protective role throughout this pandemic and will remain an important part of our daily routines for some time to come. In preparation for the move to Alert Level 2, public health officials have worked diligently to develop guidelines related to further expansion of public spaces and gatherings, recreational activities, businesses, and healthcare services. And while I will briefly touch on some of these today, I encourage you to visit gov.nl.ca/COVID-19 for more detailed information. Beginning tomorrow, outdoor gatherings of up to 50 people will be permitted as long as attendees are not symptomatic and practice proper cough and sneeze etiquette and hand hygiene and can maintain a safe physical distance of at least 6 feet between them and others outside of their bubble. Large mass gatherings beyond 50 will still be prohibited. If you are planning an outdoor gathering this summer, please keep in mind 4 important words: people, space, time, and place. We know the greater number of people we interact with, the greater the risk of spread of COVID-19, and that physical distancing is crucial to reducing our risk of contracting the virus. We also know the longer amount of time we spend together, the greater the risk of infection, and that it is less risky to spend time together outdoors than indoors. So please that these principles continue to guide your activities and routines in Alert Level 2. While places of worship will be permitted to resume services with restrictions in place, leaders of the faith communities have advised that they are all in different stages of preparation to resume worship services. On their behalf, I kindly ask for your continued patience, as some organizations may require additional time to adjust to a new way of operating. Gyms and fitness facilities may reopen with restrictions in place, as can arenas and indoor pools. Camping activities have been expanded, and playground equipment in public parks may now be used. Bars and lounges are permitted to reopen with reduced occupancy, and indoor entertainment facilities such as bingo halls and cinemas may also open with reduced occupancy and restrictions in place. While performance spaces may also reopen with reduced capacity, this does not include festivals and events or any other mass gatherings. Thank you for your continued patience and support as businesses continue to reopen in a modified way to safely provide services to the public. Regional health authorities will continue to allow more healthcare services to resume. As we continue to relax public health measures and people move about more freely, we can fully expect to see new cases of COVID-19 in our communities. How well we do in keeping this virus contained depends on each of us. So please continue to do your part by staying informed and following public health guidance at all alert levels in our provincial Life with COVID-19 plan. As a recap, for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 261. Together, we have reached another important milestone in living with COVID-19, and one that affords us the ability to spend more time with the ones we love doing the things we enjoy. As you set out this summer with family and friends to explore and experience what our beautiful province has to offer, please continue to be COVID-wise and be safe. Thank you.
Thank you, Dr. Fitzgerald. I'm also pleased today to be joined with Minister Haggie virtually and right here in person with Dr. Fitzgerald to report that we have maintained our good run at no active cases of COVID-19 in Newfoundland and Labrador. Today, as been mentioned already, marks day 7 with no known active cases, but it also marks day 27 without a new confirmed case. This proves that collectively as a province, we have come together to do our very best in following the public health measures that have been put in place. Now, as we move into Alert Level 2 tomorrow, our focus is to control transmission of this virus while further reopening social and business activities, which ultimately means that we get more residents, back to work and back to their regular office environments. But we must do so safely. As we all know too well, in order to be successful, we must remain vigilant. Things like wearing a mask and practicing physical distancing is our new normal. So let's continue to work together as we move forward. Our plan, NL Life with COVID, is doing just that. Over the past few weeks, there has been a lot of discussion, a lot of questions about traveling to the province and creating an Atlantic bubble. Last night, I met with my colleagues in Atlantic Canada, Premier Blaine Higgs in New Brunswick, Premier Dennis King in Prince Edward Island, and Premier Stephen McNeil in Nova Scotia. And we had a discussion about what an Atlantic bubble would look like and what restrictions would be put in place. And over the last few days, public health officials have also been meeting on this very topic. So earlier today, we released a statement through the Council of Atlantic Premiers that we have committed to easing travel restrictions in Atlantic Canada. The number of COVID-19 cases remain low in each of the 4 Atlantic provinces, so a decision was made to create an Atlantic bubble. So the question will be then, how will that work? As of next Friday, July 3rd, residents in all 4 Atlantic provinces will now be permitted to travel to Newfoundland and Labrador, to New Brunswick, Prince Edward Island, and Nova Scotia. And they can do so without the requirement to self-isolate for 14 days. The thing to remember is that this does not apply to visitors from other Canadian provinces or territories. Now, travelers outside of Atlantic Canada must adhere to the entry requirements in place in each of the 4 provinces. So if you know someone from outside of Atlantic Canada who plans on traveling to Newfoundland and Labrador, they must self-isolate for 14 days before they can travel within the province. The decision to ease travel restrictions within Atlantic Canada was guided by all of the provincial chief medical officers of health. Decisions like this one are not taken lightly. As this Atlantic bubble opens, it will be closely monitored as we remain committed to working together to support economic and social recovery while ensuring public health and safety measures for all our residents. So while traveling amongst Atlantic provinces, well, that's easing, but all public health directives for each province must be adhered to. This includes not traveling if you have any symptoms of COVID-19, and you must always practice physical distancing and good hand hygiene. Now, if you have any questions about Alert Level 2 or traveling to Newfoundland and Labrador, we once again ask you to visit our website, gov.nl.ca/COVID-19. Our website, once again, is the latest, most up-to-date information. It is your trusted source of all things related to COVID. Now, one other consideration as we open up is the close family ties that we have to provinces like Alberta and Ontario. We have many families and friends who have not been able to reunite during this pandemic. Many have had to deal with some significant family situations during this time. So we would also like to say that if all goes well in both Alert Level 2 and the easing of travel restrictions in the Atlantic bubble, our plan will be to further ease travel restrictions. So again, what does that mean? So as an example, if those of you who have family and friends who are waiting to visit from another Canadian province, like Alberta and Ontario, where we have many family and friends, we would permit travelers from other parts of Canada starting around Friday, July 17th. Now, this can only be possible if we get favorable results in the days and weeks leading into July 17th. So in order for this to work, we must have to maintain good public health measures. We will never hesitate to go back if we have to. Your actions today will determine our results of tomorrow. So continue to wear a mask, wash your hands, practice safe physical distancing. So once again, we need to thank you for the great work that you have done so far. We are at this point right now because of the great strides that we have made together. So let's keep the momentum going as we ease travel restrictions, reopen the economy, reopen social activities, and transition people back into our offices. It is only by working together that we can continue this success by keeping COVID at bay in Newfoundland and Labrador. As we take advantage of the great weather and get out and explore the place that we all love and we call home, let's also remember to shop and support local businesses. Let's take some time to think about where you want to spend your staycation this year. What part of our beautiful province that you have yet to visit? There are countless of attractions and craft shops and restaurants and places to stay right here at home in Newfoundland and Labrador. The people that own and run these businesses are our families and their friends, they're our neighbors. So these are the local businesses that support many of our community organizations throughout the year. It's these businesses that connect us and bring us back to our roots and our culture. Now, before I conclude my remarks for today and before I pass it over to the Minister for his comments, a reminder to everyone is that our next briefing would typically be next Wednesday, July 1st. Of course, this is Memorial Day and Canada Day in Newfoundland and Labrador, so we will not be holding a briefing on that day, but we will be in touch in the coming days about our plan for the next week's briefing. So until then, I hope that you will get out and enjoy the great weather, but please do it in the safest manner possible. We have to make sure that we can still have some fun while staying safe. By doing this, we'll continue to see these great results as we move our province forward. As Dr. Fitzgerald said, it takes patience, and we thank you for your support. We put a plan in place, so let's stick with the plan. It is working. I will now pass it over to the Minister Hagee.
Thank you very much, Premier. 0 cases, a flat line again for the 27th consecutive day. So thanks to everyone for all their hard work and diligence. And as we move through the alert levels, we can see that we are doing it in a staged way, and we have not had any significant setbacks. However, as Dr. Fitzgerald says, we will see cases, and we currently, across the healthcare system, are well placed to manage them. We have an excellent public health team. We had one of the best contact tracing records in the country, and we have hospital capacity. It is currently 70% occupancy, and the RHAs, the regional health authorities, we've spoken to them again to make sure that they are on track for as speedy a return towards normal working as possible. Level 2 will bring with it resumption of even more services, such as routine diagnostics and planned lab work. And the people who have had that put on hold over the course of COVID-19 will be receiving communications about that in the coming weeks. One of our challenges around the most vulnerable people we have is around long-term care facilities. And visiting in general has been the hardest thing we have had to manage over the course of this pandemic. There are still visitor restrictions in acute care where we have people who are sick or immunocompromised and very susceptible to infections. But it's obvious from looking at other jurisdictions that the risk to the people of this province is principally borne by the old and those with other medical problems. So long-term care and personal care homes are areas of particular concern. We will continue to safeguard them as we move through the alert level. We are working with the regional health authorities and infection and prevention control to look at what the art of the possible might be in terms of where a safe spot is to land with visiting for long-term care, particularly. Given the fact that a vaccine under ideal circumstances is not going to be trialed anywhere in the world until into the fall of this year, and the results then will still not be clear until around Christmas time. So that is our area of concern, and it's been a focus of all our attention. And we have been almost singularly successful thus far, thanks to everybody's hard work and patience with keeping this virus out. But it has, again, been the most difficult of the decisions that we have made. I'd like to draw attention to the fact that also June is Stroke Awareness Month. We have a significant burden of illness due to stroke. We've been working to enhance the provincial stroke program with Dr. Brown and others in St. John. We have also had considerable support and assistance with the Heart and Stroke Foundation, and I would like to give them a shout out too for all their assistance over the last month and the last year particularly. They raised a considerable amount of money to support work in this area, and they are to be congratulated on the work they've done. Another abbreviation to remember for people in Stroke Awareness Month is FAST. So face, droop, arm, not working, speech, slurred. It's time to call 911. We have special protocols in place for stroke, so they're taken straight to centres that are able to rapidly respond to those needs. And our successes in this area now with the new clot-busting treatments for strokes are starting to make a difference. So again, it's an important issue for a lot of people and a source of some significant challenge to the healthcare system for people whose strokes complete. So again, just to round out on the COVID briefing, Dr. Fitzgerald makes an excellent comment about the new guidelines we have, or the new way of expressing them, in people, space, time, and place. A few people, shorter time, out in the open, and for all of us, that has worked very well. And I would encourage you to continue with this as we move into the next phase of NL life with COVID-19. So with those few remarks, Premier, I would hand the event back over to yourself.
Well, thank you, Minister. We will now open it up to the media for questions for today.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Dr. Fitzgerald, do you feel you were properly engaged and involved in the government's decision to join the Atlantic travel bubble after our province seemed to be one of the ones holding out?
So we provided guidance with regard to the Atlantic bubble, as is our job to do. And so, yeah, I think we were appropriately engaged.
All right. And I'm looking for some more clarification about the July 17th date. Is that for anyone within Canada? Obviously, I know it's a hopeful date, but with that, is there also no self-isolation to be imposed?
Yeah, so what you will see there is an asterisk just about any of those dates. That would be the earliest possible date, given the fact that, July 3rd to July 17th is one incubation period, of the virus. That's how we've been measuring this, of course. So July 17th for those people outside of the Atlantic bubble would be what we would see as, working with public health officials, of course, as the earliest possible date. Then they would be able to move into Newfoundland and Labrador and visit family and friends, like anyone within the Atlantic bubble would be able to.
Yesterday and this morning, the province launched its stay-home year, but now today we're opening up the borders as of July 3rd and then potentially July 17th. The timing just seems to not quite coincide with the stay-home year. I guess your remarks on encouraging people to still travel within the province.
Well, the staycation is something that, of course, we're promoting here as a province, because given the fact that, many of the hospitality, the accommodation, the tourism sector has been hit extremely hard, we've always said, first and foremost, we must demonstrate that we can move around our province safely before we open it up. And I think we've been able to, provide that level of confidence. So right now, it's always staycation. I've mentioned that in my comments, is that we're encouraging people to stay in Newfoundland and Labrador for all the economic benefits that we see attached to Newfoundlanders and Labradorians staying home here and supporting local businesses.
Thank you.
Our next questions are from Meg Roberts of CBC News. Please go ahead.
Dr. Fitzgerald, there are people who say they are worried and concerned about letting visitors in. What do you say to them?
So when we placed the travel restrictions, or when we put the travel restrictions in place, we said at that time that, releasing those travel restrictions would depend on epidemiology elsewhere in the country. And certainly when we look at the epidemiology of COVID-19 in the Atlantic provinces, it's very similar to ours. Most provinces have had very few, if any, cases over the past couple of weeks, for sure, and I think we can safely travel back and forth between the other Atlantic provinces and Newfoundland and Labrador.
New Brunswick is going to allow seasonal residents from other provinces. Will those people be able to kind of keep on driving until they get here to the province, or will there be some type of screening?
So
you're thinking about people from, are you thinking of the secondary residents, people that own property here, Meg?
Yes, and people who own property in other provinces, for example, New Brunswick, will they be able to come to Newfoundland even though they might be an Ontario resident and then spend the summers in New Brunswick or wherever?
So right now, anyone coming outside of Atlantic Canada, you must isolate for 14 days, and that's the same, understand in New Brunswick, in Nova Scotia, and in PEI at this time.
And gyms, yoga studios, recreation centers are included in the Alert Level 2 plans, but there doesn't appear to be any guidelines out yet. So how are they supposed to open safely tomorrow without those guidelines?
So there's been engagement happening before the guidelines go up on the web. We've engaged with stakeholders to ensure that we get their feedback. So there's, even though we haven't seen it on the website, doesn't mean that it hasn't been out there for people to view and to provide feedback.
Thank you very much.
Our next questions are from Linda Swain of BOCM News. Please go ahead.
Bar owners say the guidelines are coming with Alert Level 2 are too restrictive. Will the move to an Atlantic bubble
I think we kind of lost the last piece of that question.
will the move to an Atlantic bubble be allow the further lifting of restrictions? Bar owners say that the guidelines right now are a little too restrictive. Will we see any of those lift in the next little while?
So I think we, certainly we put guidelines in place to try to reduce the risk as much as possible, recognizing that, people will be moving about more, and that reduced capacity, trying to reduce the chance of close contact between people, and that was the reasoning for the guidelines. I think if we open up to the Atlantic bubble, then we have to consider that there will be more movement of people around. So I think at the moment the guidelines are as they are, and we'll certainly be looking at what happens with opening things up in Level 2, as well as the increased travel in Atlantic provinces, to see how we can move forward.
Yeah, I think what you're seeing within the restrictions that's been put in place is very similar to what you would see in other provinces as well. I mean, you look at Nova Scotia, New Brunswick, and PEI and other Canadian provinces, you would see that there was a lot of restrictions on bars and restaurants, as an example. We understand the impact that this is having, but first and foremost is we actually get into, there's always a risk assessment, as we said, real early into the alert level plan. Risk assessments that will be done, realizing those restrictions are in place, but also realizing that there's some support for those businesses, federally as well, and some support from the province as well to help them. It is a difficult time. We understand that. But we must open up very slowly as possible and keeping safety of staff and their customers, front and center. So, continue to monitor it over time. If indeed we see in the future where this can be done in a more safely manner and not affecting public health, well, then these are decisions that you make after that monitoring.
This has been a troubling time for people who are awaiting surgeries or procedures that have been delayed or canceled outright. How will those surgeries and procedures be triaged? Is it determined through the doctors, through the health care authorities, or is it through public health?
Linda, that's a very good question. It's a very topical one and one we get asked very regularly. The short answer is that is a clinical decision based on the condition of the patient, input from the primary care provider, and the specialist who is concerned with the procedure or diagnostic. That has been the criteria from the get-go. And anything that was deemed urgent or emergent, even back in March, was permitted. We were fortunate in that we could do that, unlike Ontario, for example, which stopped even cancer surgeries and chemotherapy because of their challenges. In terms of those people who've been deferred since the beginning of COVID-19, each of the specialists was tasked with going through those individuals' details on a periodic basis to make sure there was no deterioration or adverse effect from that, and to manage that where that arose so they could be bumped up or moved. The RHAs and the specialists are discussing this on a regular basis, particularly now as we move to level 2. And in actual fact, when I go off this call now, I have a meeting with the Newfoundland and Labrador Medical Association to seek their input on how waiting lists and backlogs should be addressed to make sure we clear it up as expeditiously as possible.
Thank you.
Our next questions are from David Marr of The Telegram. Please go ahead.
Thank you very much. Dr. Fitzgerald, multiple sources have told me that you had opposed the move to open up the Atlantic bubble that's been announced today. I'm wondering if you could kind of detail your position on opening the Atlantic bubble today.
That's not the case. No, I certainly, as I've said before, that we looked at the epidemiology, and certainly the epidemiology at this point recommends or indicates that it will be safe to have an Atlantic bubble, and that's been our advice and guidance.
Maybe I need to clarify some things. None of the decisions that's been made by public health has ever been forced. And this Atlantic bubble, we have worked very closely with all of Atlantic provinces, taken the advice of the great work that public health officials, led by Dr. Fitzgerald, has done. That is what made this province successful. So this whole idea of being forced into an Atlantic bubble is simply just not the case. We work very closely amongst provinces with our public health officials. The advice, that's how we make our decisions. That is a proper way to do this, and no different than, the decisions that we've made in the future. We've worked together, we've been successful together, and recognizing that, opening it up to Atlantic Canadians was, there's economic considerations, but first and foremost, it was public health and safety that was considered first and foremost, and that won't change. Keeping people safe, keeping Newfoundlanders and Labradorians safe is the primary objective for all of us as we make our decisions to move forward.
Thank you. I appreciate the clarification. Will there be an accompanying kind of increase in testing, whether it's in this province or throughout Atlantic Canada? But will there be an increase in testing accompanying the opening of the bubble?
So at the moment, we're in the process of developing a testing strategy that will take us into the fall when we anticipate an increase in cases. At the moment, there is no plan to increase our testing at the border, if that's the question. But we will certainly be looking at the best way forward with regard to testing and with regard to all types of testing.
I will say, too, that as we move around Atlantic Canada, there's still information that will be collected, at the at the checkpoints, some in the airports and the ferry at the Port of Bass ferry as well. So we'll still gather information that's required, and this will still be the case in places like New Brunswick and PEI and Nova Scotia as well. So still some monitoring done at those entry points.
Thank you again. And so we're talking about an Atlantic bubble, but I think people are still wondering about personal bubbles. So I'm just wondering, has there been any changes to how many people you can have in one's own bubble, and how exactly that process kind of would come about relating to the shift to alert level 2?
So right now, what our advice is obviously, you have your bubbles as they are, which was the double bubble and then the extended bubble with the extra people in. And really what we're saying right now is, as we start to move about more, is that you need to keep your contacts outside of your bubble as low as you can, your close contacts outside of your bubble as low as you can. We recognize that as people start to move back to work and as people start to get out more and play sports and do things like that, that you are going to have some close contacts outside of your extended bubble. But those should be as low as possible, because the fewer close contacts you have, the less chance of you contracting the virus should it start to circulate again. But also, if you were to become sick, the less chance you have of passing it on. So, it is important to remember that, and we recognize that there will be some contact of people outside of that extended bubble. But the really close and consistent contact that you have in your lives should still be that close household, double bubble, extended bubble of your very close friends or family. That really should be what your core contacts are in your life.
I think Dr. Fitzgerald raises a real good point, because as we extend, the extent of the people that we would be in contact with, it, once again raises the heightened responsibility, personal responsibility for each and every one of us, to use some common sense, be responsible, make sure we just maintain the good efforts and the good work that has got us to where we are today. So I think as we expand the number of contacts that you have in your life, there comes a heightened responsibility to do so, with just using common sense and practicing the public health measures that have been put in place. So that is really what it's coming down to. And as we expand and see more travel within the province, as we travel more ourselves, that it really is a very common sense approach that we must continue to use. And likewise for business owners, they too now have a greater responsibility to make sure that their staff is protected, and making sure that people that enter into their various businesses, that they follow those guidelines as well. So what I'm saying is the whole province must work very close together, never lose sight, because of what we are trying to prevent is a setback. That's what we're trying to prevent. We do not want to be able to do that. We want to continue to make progress.
Thank you again.
Our next questions are from Ashley Fitzpatrick of All Newfoundland Labrador. Please go ahead.
Thank you. Premier, you mentioned a meeting last night with the Atlantic Canadian premiers. I just wanted to... There are concerns that were raised in that meeting?
Ashley, I'm sorry, we lost a few words of your question there. You mentioned about the meeting last night, and then we kind of lost.
Yes, sorry. I'm just wondering, on the meeting last night, if any specific issues or concerns were raised during that meeting.
No, a lot. It was. We meet every week, and sometimes more than that. But it was really about just making sure that everything, from a public health point of view, our healthcare system, the checkpoints, what would happen in each province, and there's a very firm understanding that provinces still can make decisions based on their own population, based on their own circumstances as well. So this is really just opening up provinces that have done a very good job. And as Dr. Fitzgerald said, the epidemiology within our provinces right now are very similar in 4 provinces in Atlantic Canada. So it's just about, opening it up in a very staged approach, strategically working within Atlantic Canada. So that was really the focus of the discussion that we had with our premiers last night.
You. I know that we have, managed to step down these levels. What I'm wondering is, when we start talking about bringing in more tourists, it naturally turns to more bookings and looking ahead to the future just a little bit. I'm wondering if there's any messaging that's coming from the province or anything that you'd like to say about the consideration of what may happen if we suddenly have to change our levels of where we are. I guess how quickly can we adjust in those instances?
Well, this is the thing, and I mean, this is one of the reasons why, and the success that we've seen within the province with this current alert level, 1 to 5, and so we still have our public health state of emergency in place, so we can actually move rather quickly. And with the experience that we've had within the last couple of months and being able to actually measure the indicators, right now, so we're in a much better place than we would have been, let's say, in April of last year. That experience has taught us a lot. Public health officials are monitoring other jurisdictions and seeing what's happening there as well. So I think that we're in a position to quickly respond, giving the alert level system, giving the public health state of emergency that will remain in effect.
Thank you.
Our next questions are from Marie Isabelle Rochon of Radio Canada. Please go ahead.
Thank you. Hi. Wondering first, I'm looking to have again more detail about the opening up of the border in July 17. So are we talking about only members of the same family? Can you just really describe who would be allowed, or is it anybody? And again, even people who are coming from areas like Ontario or Quebec, where there's still a lot of cases there?
Yeah, so first and foremost, July 17th would be a number if we have success and the results, are kept down. We are kept low. We must be able to demonstrate first and foremost, as we have, that we can travel around our own province here in Newfoundland and Labrador. The same thing holds true for moving around Atlantic Canada. We must be able to demonstrate that we can actually do that safely as well. Then monitor the situation before the final decision is made. But based on the incubation period, 14 days after July 3rd would get us into the July 17th timeframe. And then look at the epidemiology in other provinces, decisions then, working with public health. Only then can we make a decision on how open this province can be.
Thank you. And so what is the plan if the province realize that there are more cases due to the Atlantic bubble with more tourists? Are we going to shut down the border immediately? How can people who are right now traveling inside the province will they have to get away? What is the plan exactly?
Well, first and foremost, I think we need to look at where we are now. So right now we have a very good exemption order in place that has been made traveling in, that people can actually travel into Newfoundland and Labrador right now when they look for an exemption order. So we're close to 7,000 people now that have come into our province or plan to come into Newfoundland and Labrador. Over the weekend, we had yesterday we had over close to 600 people that would have came into Newfoundland and Labrador from the various entry points. The day before that was just under 500 people. So people are now moving safely. So we know now over the last few weeks the number of visitors and people that are coming into our province has been gradually increasing. So it's the obvious next step for us right now to do so with Atlantic Canada. So then you continue to monitor where you are in the future, and then I guess first and foremost and fundamental to all of this is doing so safely and recognizing, very closely monitoring what's happening in other jurisdictions.
Thank you. And I'm still going to go back to my question about July 17th because it still wasn't clear. Will people be? They will not need to isolate if they come in the province, and it's not only for members of the same family. It will be for everybody in Canada.
That would be for Canadians then at that point, but the determination and the final decision on what the conditions would be, it's a little early to tell, but over the next month or so we'll be monitoring that, monitoring what happens within the Atlantic bubble, and therefore if we could put similar conditions in place with the rest of Canada, then the decisions will be made at that point in time. It's a little early to tell. We must make sure that we can move around Atlantic Canada safely first. That would be the earliest possible date.
Thank you, Premier. We've allotted approximately 1 hour for this news conference, so we still have a bit of time left. So each reporter is going to be given an opportunity to ask 2 quick questions each, starting with Kellyanne Roberts of NTV News. Please go ahead.
Thank you. As we look to join the Atlantic travel bubble on July 3rd, there's still many questions about the Labrador-Quebec border, as that movement's allowed for work, health services, things like that. Are we also looking to open that up for non-essential travel? Many families living on both sides of that border.
Yeah, so in Labrador West, we've met with leaders in Labrador West as well as some of the leaders in Labrador South as well, because these are two entry points into Labrador, and we've been through these, I think, a number of times. It's if you're traveling from Newfoundland to Labrador, you actually go in through Quebec and then into Labrador South. And in Lab West, there's of course, a history of both commercial and healthcare and you name it in the Lab West side for people that live in Quebec and in Labrador City and Wabash. So right now, they put in a plan. They've offered some suggestions of what it would look like, which would meet the concerns of what we would see with public health officials. So right now, they would be able to move in and out of Labrador West from the Fermat area, like they've done in the past, and likewise in Blanc-Sablon into Labrador South. So, this is where we are now as we open up those what have been typically, and historically been commercial and both social, corridors that we've seen within the Labrador regions.
Thank you.
Our next questions are from Meg Roberts of CBC News. Please go ahead.
Is there any changes to sports guidelines? I know we were at skills and drills. Will we be allowed competition or tournaments?
Yes, so I think within teams or within groups of sports teams, there will be allowance for games against your own team, so scrimmages, I guess. So that allowance has been there. Certainly with sports guidance that there's been a lot of work being done both provincially and at a national level to inform a safe return to play. So we'll be looking at that and engaging with those groups to look at how that goes past level 2.
And I'm getting a lot of comments about weddings. I know that we now are allowed to have 50 people gathering, but it sounds like they had to be socially distanced. So where do we stand with weddings?
So weddings are allowed with 50 people and socially distanced. Outside of, bubbles can stay together, but socially distanced outside of bubbles. So, that's something that people have to take into consideration when they're planning these events. Especially if people are going to be traveling to come into a wedding, that's something you have to take into consideration. So it will be very important for people to remember to maintain that social distancing, because that's the thing that will keep people safe. That and good hand hygiene.
Thank you very much.
Our next questions are from Linda Swain of BOCM News. Please go ahead.
I guess this question is for Dr. Fitzgerald. How long do you anticipate we'll be in Alert Level 2? The criteria for Alert Level 1 is the availability of an effective vaccine and a strong public health system. Level 1 is called the new normal, but is Level 2, in fact, the new normal?
So that's a good question. And, we're certainly looking at what level 1 really, to give more detail about what level 1 will look like. I think at this point, much has opened with level 2, or much will be opened with a level 2. There will still be some businesses, some groups that are looking to open fully. But, we need to look at, there's a lot of things happening. So there's a lot more businesses opening. There's businesses that have, greater numbers. There's also an increase in gathering size. We're looking at the resumption of some worship services and other gatherings like that. We're also looking at increased travel from outside of the province. So there's a lot of things going on, and I really think we need to give ourselves some time to assess how that's happening. That's not to say that throughout level 2 that we can't amend some of the things that, some decisions that have been made, that we can't make changes and that we can't, relax some measures a little bit further. But certainly, I think, we're looking at level 2 for a while yet. And level 1, I think, will be sort of a new normal that we will be able to move out of once we are able to administer widely an effective vaccine.
Premier, there's a greater need for childcare, of course. More people going back to work now. Are there enough spaces available? Is access to childcare an issue?
Well, we're back with Alert Level 2, back to really pre-COVID time. So right now, it's the childcare centres will be opening up in greater numbers. And so really we're back to like pre-COVID numbers for childcare spaces within the province, but we're always, want to look, it's one of the, I guess is one of the underlying things in making a decision to return to work is making sure that you have appropriate childcare spaces in place. During the pandemic, as you know, we put in place what was a very good program to support the essential workers. We were able to do that. But given the fact now that we've opened up the economy as much as we have in a short period of time, those childcare spaces now should be available as they would have been pre-COVID.
Even though capacity is reduced?
Well, right now, I guess at alert level 2, we're at the, I think we're right back to 100% again now with childcare spaces.
Thank you.
Our next questions are from David Marr of the Telegram. Please go ahead.
Thank you very much. I'm wondering, is there any specific indicators that would trigger moving back to a more restrictive alert level? Is there anything that you're looking for in terms of, the number of daily cases over a certain amount of time? Is there anything specific that would trigger moving back to alert level 3, 4, or 5?
So, first of all, I'd like to say that our goal with this is to keep moving forward, right? We want to be able to live with COVID-19, and we want to not have to go back. That's why it's so important for people to adhere to public health guidance and to maintain physical distancing and all that. We want to be able to keep moving forward. We know that we're going to see cases of COVID-19, so we've been very fortunate. We've gotten used to living with no cases. I think that people need to be aware and be ready that we are likely going to see cases. We are at a point now with our surveillance strategy, as well as with our public health capacity, and with the information that we have learned about this virus over the last 4 to 5 months. We're in a different place than we were in March. And I think that, we will be able to see cases in the future and be able to manage that without having to go down the same road that we did before. That being said, obviously, if we start to see a large number of cases for which we can't find a source, then that would be concerning to us and would make us think about other measures that we might have to put in place. The other thing we need to think about is that, we acted at a provincial level before, and that, perhaps we could focus at a more regional level in the future, and that's something that we're looking at as well. So there are a lot of things that we're thinking about with regard to how we respond to an increase in cases, and it's not as simple as just, if we start to see more cases that we'll shut down again, because I don't think there's an appetite for anybody to really go there again. But, I mean, if we have to, we will have to, but that's not our goal.
Thank you. And I'm wondering, in terms of the overall Atlantic bubble, should we see an increase in cases in New Brunswick, for example, would there be kind of a limited bubble there? Is there any kind of flexibility in terms of allowing travel within 3 Atlantic provinces and not all 4, or some such thing? How could this bubble be maintained? I guess.
Yeah. So, David, I think you're right, because I've made the comment just a few minutes ago about that each province would maintain its autonomy, and how we look after and as we adjust to public health safety. And so, therefore, if we ever find ourselves in a situation that we would, through a decision that would have been made, that we would, expose Newfoundlanders and Labradorians to a spread of COVID-19 within our province, well, of course, we maintain that autonomy. We make that decisions based on the information from our province and the impact on our residents. So right now, and we see that within all the other Atlantic provinces as well. They're no different than they would. They want to make sure that they can make decisions that is all and solely based on what's happening in their provinces. We would see just recently when New Brunswick had to shut down a region and actually move from one phase back to another phase in the Campbellton area, and they've done that successfully, and they've been able to control the spread within that area. So right now, as Newfoundland and Labrador, we maintain our right and our privilege, the autonomy of making decisions based on public health measures. We can do that to protect Newfoundlanders and Labradorians. But as Dr. Fitzgerald said, the whole objective here is to continue to make progress and not wanting to have a setback. But, rest assured that if we need to make a decision to protect our province, well, we will do that.
Thank you again.
Our next questions are from Ashley Fitzpatrick of All Newfoundland Labrador. Please go ahead.
Thank you. I just wanted to ask about, in terms of this precautionary idea, I'm just wondering if there's been much discussion or how deep the discussion went on really beefing up things like testing for travelers coming into the province. I think a big question for a lot of people would be why we're not getting particularly aggressive on that if we're going to let in more people from outside of the province.
So testing has been a big conversation at every table, and how we approach the testing. And what we have to remember about this test that we have right now is that it's a diagnostic test and not a screening test. So it's meant to diagnose someone when you have suspicion that they have a disease, right? So using it as a screening test, it brings with it inherent problems with regard to false negative tests and false positive tests for that matter. So screening everybody at the border does not give us reassurance that the disease is not coming in, because there is a 20 to 30% false negative rate. And so just because you have a negative result in someone who's asymptomatic, you're not as, you can't be 100% reassured. So if people are thinking that we can use that test as a screen when people come into the province to ensure that they don't have the disease, then it's not particularly useful in that regard. Now, some areas are using it as part of the process that they put in place. But if we have concerns about an area that somebody is coming from, then certainly self-isolation for 14 days is much more effective at making sure the virus is not going to enter the province.
And when you think about work that public health has done on this, and even just the criteria around screening, and they've been able to, because of the evidence and the science that's around this, being able to, give most people an opportunity if they're, once they show symptoms, to access, screening. We also know at the federal level, there's a lot of discussion around a national strategy, what that would look like. But Dr. Fitzgerald is absolutely right in terms of, determining should people come in on any given day. It's, that's not what this test was designed for.
That's actually it for me. Thank you.
And our final questions today are from Marie Isabelle Rochon of Radio Canada. Please go ahead.
Thank you. For weeks, your government didn't seem open to the Atlantic bubble. Why wait so long to announce suddenly that there's a change of mind? Maybe businesses, accommodations, and businesses that work with tourists might not have time to prepare for more tourists. Even residents of Newfoundland and Labrador who have been listening to those briefings every day, they might feel really insecure regarding this new measure because they have been told over the last 2 months about the dangers of opening up the border. So why give such a short notice before announcing this measure?
Yeah, so there's been a lot of discussions, as we've said already, with public health officials and with, with premiers as well. This whole idea all started with, from Premier King within PEI, and then the idea, I guess, got some discussion. Public health officials had their own discussions and all this as well. So I've always said that first and foremost, we had to demonstrate that we can move around Newfoundland and Labrador safely. We've had 27 days of no positive cases. Now we're at a stage where there's no active cases within Newfoundland and Labrador, and we're still 11 days away from July 3rd, so there's a lot can happen. But rest assured that the asterisk behind all of this is that if we have to make a decision to slow things down, we will. But right now we feel that working with public health officials, working with other provinces, just getting a real better understanding of what's happening amongst 4 Atlantic provinces, we feel right now that we can move around Atlantic Canada safely and not be increasing the number, the exposure rate for Newfoundlanders and Labradorians. So this is where we are. We're still 11 days away. One thing that has been asked of us as well is that when you're prepared to make a decision and put some kind of date in place, give people the opportunity to make plans. So this is what this does. So July 3rd is still a few days away yet, so people can make their plans to move around Atlantic Canada. This is the reason why it's taken the time that it did. making sure that all 4 jurisdictions were in a good spot and they could move around each other's jurisdictions safely. I think now we've demonstrated that we can do that.
Well, you're talking about making plans, but other provinces, for example, New Brunswick, they have been told for a while now that their province were okay or talking about being in an Atlantic bubble. Here in Newfoundland, there wasn't the case. It seems that they might not have an Atlantic bubble. People were not sure about it. So 11 days is not a lot, actually, for making plans and preparing themselves for more people to come into province.
Well, I guess you could argue whatever date you want and what's appropriate in making plans. And right now, then, whether you come in July 3rd or come in sometime after that, that's really a personal decision that one would have to make. I mean, the decisions that we make are based on the information that we have within Newfoundland and Labrador. I mean, if you look at, where some other Atlantic provinces were back a few weeks ago, just at a region closed in New Brunswick, that was something that was considered by Atlantic Canadians as well. And so right now we've made the decision amongst all 4 premiers, working with our public health officials who have been engaged in this, all along the way here. The decision and the date that we settled on would have been July 3rd. That is after July 1st, which would be Canada Day, and people would expect, that there would be, did not want to find ourselves in a situation where that we'd see, large gatherings of people from out of the province. Get July 1st celebrations out of the way, then open it up on a Friday on July 3rd so people can make their plans to travel around Atlantic Canada.
Thank you very much for joining us today. The time for questions has ended. As the Premier stated earlier, please stay tuned for the date of our next week's briefing, and have a great evening.